Respiratory disorders. First is bronchial asthma. Bronchial asthma is a narrowing of the tracheobronchial tree due to presence of allergens. Factors are intrinsic. Under intrinsics is flu, common colds, upper respiratory tract infection. For extrinsic, caused by dust, pollens, for perfumes, chocolates, climate, food and drug allergy, peanuts, stress. It's also a reaction to allergens that is immediate. Manifestation. First is bronchoconstriction that lead to shortness of breath, difficulty of breathing, nasal flaring. Use of accessory muscle, cold and clammy respiration, restlessness. Restlessness is the first sign of hypoxia. Second manifestation is acid-base balance. For early attacks or signs and symptoms is hyperventilation. Hyperventilation will lead to increased level of oxygen in the body that leads to respiratory alkalosis. Late signs and symptoms is hypoventilation. It leads to increased carbon dioxide level in the body that leads to respiratory acidosis. Hypoventilation, watch out for sudden cessation of wheezing as it may indicate total airway closure or blockage obstruction. The respiratory acidosis and total airway obstruction can lead to acute respiratory failure. Management plan of care. Priority. Establish airway. For acute attack, drug of choice is epinephrine given sub-Q in 3 doses. Bring patient to the nearest ER. Tip to remember for EpiPen, rapid acting and short acting. That's why you need to bring the patient to the nearest ER. For the latent phase, drug of choice is theophylline and aminophylline. Tip to remember, it is a long-acting bronchodilator. Side effect, increased heart rate and palpitation. Second management is to nebulize with salbutamol and corticosteroid for anti-inflammatory. Side notes, if bronchodilators and steroids are given at the same time, the first to administer is bronchodilators and the second is corticosteroid. Second management is to promote breathing or lung expansion. For position of choice is orthopnic. It is the best position and sitting. Next, upright or neutral or high backrest. Deep breathing also promote lung expansion. Chest physiotherapy. The purpose is to dislodge the secretion. Side notes. Goblet cell is a basic unit of the lungs. Function is to produce mucus if there is allergic reaction or infection. Contraindication for chest physiotherapy is a collapsed alveoli, atelectasis, rib fracture, hemoptysis. So avoid physiotherapy in these cases. Also, to increase fluid intake is part of management. And then administer O2. And for positive allergen, drug of choice, give antihistamines. Complication of bronchial asthma is status asthmaticus, which is the patient does not respond to medication within 24 hours. So management for status asthmaticus, report to healthcare provider, prepare intubation set and mechanical ventilator. Diagnostic test for bronchial asthma is peak flow meter. It is measured by forced expiratory volume. This peak flow meter has 3 zones, the red, yellow, and green. The red zone, the expiratory volume is less than 50%. So management for the red zone, it needs a medical attention. So bring to the nearest ER or apply EpiPen if available. And for the yellow zone, the expiratory volume is 50 to 70%. So management for the yellow zone is give medication as bronchodilator and corticosteroid. For green zone, expiratory volume is 80 to 100%. So it is a normal ventilation. The management for the green zone is continue monitoring the patient. COPD or chronic obstructive pulmonary disease. It is caused by bronchitis and emphysema. Bronchitis is caused by smoking and emphysema is caused by bronchitis. So emphysema is a complication of the bronchitis. Side notes. Goblet cell produce mucus if there is allergic reaction or infection. Pathophysiology of chronic bronchitis. It is an inflammation of the bronchi that leads to goblet cell activation during inflammatory process that leads to increased production of mucus. Increased production of mucus will lead to mucus plugging that causes difficulty of breathing and orthopnea. Also lead to carbon dioxide trapping that increases carbon dioxide level, that shows clubbing of fingers and cyanotic in appearance, also called as blue bloaters. Side notes, elastase or surfactant is responsible for respiratory lung recoil. Lung recoil is to expel carbon dioxide. Pathophysiology of emphysema. So decreased elastase production will lead to distended alveoli that causes three outcomes. First is carbon dioxide trapping that leads to vasodilation and the flushing of the skin that is known as pink puffer. So the distended alveoli will also cause difficulty of breathing and compensatory mechanism that leads to the lungs will adjust. It will overinflated and the compensatory mechanism is the chest muscle adjust. So it will cause barrel chest. Management of COPD. Mnemonic is COPD. C for corticosteroid. And the diet is high protein, high calorie, high fat, and low carbohydrates, because carbohydrates, the end product, once metabolized, is carbon dioxide. And then for the O2, low flow oxygen 1 to 3 liters. For sleep breathing for emphysema and diaphragmatic breathing for chronic bronchitis. Drugs for COPD is beta agonists, methylxanthines, leukotriene modifier, mast cell stabilizers. Other management is annual flu vaccine. Pneumococcal vaccine every 5 years. Disorder under respiratory is called acute respiratory failure. It is a terminal stage of lung disorder. Pathophysiology of this is starting with hypoventilation. So hypoventilation, PaO2 less than 50 is called hypoxemia, and PaCO2 more than 50 is called hypercapnia. Both leads to acute respiratory failure. Management for acute respiratory failure is mechanical ventilation.